You're probably hearing lots of great things about herbal therapy. So why is it your doctor still isn't recommending herbs? Watch this video to find out why. Hello, I'm Dr. Bill Rawls. Question: why don't many conventional doctors prescribe herbs? The short answer is it's just not part of the medical school curriculum. They're not trained to understand and use herbs. They're trained to understand medical therapies, which typically includes drugs and surgery. Part of the reason for that is drugs and surgery act acutely. They specifically address symptoms and processes. But what we're doing with these tools is artificially blocking those processes, so it doesn't necessarily restore wellness. And a lot of physicians don't understand that herbs work very differently than drugs. So herbs often take a lot longer to work, but they have a higher capacity to actually restore wellness. And the reason is because herbs actually address the causes of illness, which is very different than drugs and surgery, which address the processes of illness. It's the difference between how somebody's well, how somebody's sick, and why somebody's sick. So herbs address the why. We become ill because our cells become ill, and that is damaged by free radicals, poor nutrition, other kinds of stress factors, microbes, all of these kinds of things that affect our cells and affect our systems. Herbs counteract those factors. Healing takes time. So you remove the stress factors, the obstacles to wellness, and it takes time for cells to heal. So herbs work much more slowly, and herbs are different in their complexity. When you talk about drugs, you're talking about one specific targeted chemical. When you're talking about herbs, you're talking about a spectrum of chemicals that can vary from plant to plant that have all these broad effects on restoring the health of cells. So it's harder to standardize herbs. Doctors like things that are standardized and specific that they can use in specific protocols. So we're seeing a gradual change that more physicians are starting to recognize natural therapies, whether they actually use them in their practice or not, but it's going to take a while before I think it's incorporated into our conventional medical system. What you can get the most out of from the medical system is if you become acutely ill. So stabilizing those processes of illness with drugs when you've had an acute insult, like a broken leg or a heart attack, can be really valuable. But when you're trying to restore your health from chronic illness, herbs are a really important part of the choice. So if you find this information useful and you'd like to know more, check out the website, vitalplan.com. And while you're there, sign up for the newsletter to keep this information coming your way. So in the meantime, stay well and take care.